Welcome back to another edition of the Hart to Heart Podcast. And my guest today is Dr. Sean O'Mara, MD, JD. So Sean, welcome to the show, brother.
Hey, great to be with you, Mike. Excited.
So, I've seen a lot of your videos online. All your content is really right up my alley. Discussed, visceral fat a little bit on the show before with Dr. Jamie Seaman, a little bit with Dr. Kyle Gillette. Seems like this is something that, you're really into. So I do want to chat about that with you today. But, before we kind of get into it, Sean, you got a really interesting background, like I said at the start of the show, MD, JD, you're the first one I've had on. I think I've had, over 150 guests, probably had 50 to maybe even 100 doctors on this show, but I'm pretty sure you're the first MD, JD. So why don't we start there just with a little bit of a brief background about yourself?
Sure. So, my earliest ages on, I had an interest in medicine, just going to doctors and collected first aid kits, and Christmases and birthdays were like first aid kits, Johnson & Johnson first aid kits. I was fascinated by all that. But gradually, I got interested in law enforcement, and I didn't do so great in school, so I just kind of migrated away from medicine and my interest in it to more reachable goals. So I went in law enforcement, worked as a police officer, worked even as a police officer in college. So back then, you could be a police officer at the age of 18. I don't think that's possible anymore, and that's probably a good thing because it's pretty important responsibility that you do there.
What were you doing at 18 as a cop? I didn't even know that could happen.
Yeah. Well, back then, keep in mind, I'm standing in front of the age of 61, and it was 43 years ago that I was a cop in New Jersey. So it was pretty remarkable. I think back, that a human being could be talking about being a police officer 43 years ago. Is kind of startling, but especially somebody, like myself. It's just my lifestyle is, I still feel like I'm 20, and it's hard to say, yeah, I was a cop 43 years ago, but I was, and I loved it. And I did it for probably 3-4 years and 5 years maybe. And I ended up going into undercover narcotics work. I was an investigator, was involved in organized crime, investigating that. Lots of that in that particular area, New Jersey, Philadelphia. So I have a very strong background in law enforcement. And then I ended up actually going to law school. I did well enough. I went to a community college, saved tons of money going to community college, got straight A's, had the best teacher of my life at a community college. They just opened my mind to learning. And then went from community college to Penn State. Finally, I graduated from university and then went to law school. And I worked as a criminal prosecutor for 3 years. And then, having done well enough to get into law school, and I felt like, hey, maybe I could go to medical school. My interest in science and medicine continued to pursue me. It just seemed to pop up in so many situations. So I went back to college, Mike. I hung up my suits, put on jeans and sweatshirts again. And I actually worked part-time as a security guard at nighttime, even though I was an attorney. And it was pretty accomplished in my professional field. I put on a polyester uniform with a little cap, and I worked as a night watchman. I was single, and I studied. I studied all night long, drank coffee and ate beef jerky. We'll set aside whether that was such a healthy thing, but that's what I did. And I worked at a beef jerky factory which allowed me access to all that Slim Jims, if you remember those.
And of course. I'm a big beef jerky fan, actually.
Yeah. Well, now I eat a little better. I eat better quality beef jerky than Slim Jims. But in the day, right, you got it for free if you worked there. So I did well enough studying all night long that I was able to get, accepted to all my medical schools I wanted to. I did well enough on the MCAT to get in as well. And I got a scholarship through the U.S. Army because having paid for, my college and law school, I was in debt and had a lot of school loans. So I said, this time I'm going to do this better and try to get scholarships. And I did. So the U.S. Army and the U.S. Air Force and the Navy also offer this. And I guess the new command, Space Command, probably does this as well. They'll pay your way through medical school, and your payback is 1 year for every year they pay for. So it's basically the same deal they give ROTC, only they're paying a lot more. So your value on that is a way better deal than going through ROTC. So I loved it. I just actually retired from the U.S. Army only a couple months ago as a full colonel, and I'm very proud and grateful for the opportunity to serve my country. And two of my kids today are both lieutenants in the U.S. Army, so they followed in my footsteps. So I'm excited, and I think my military service gave me some interesting insights and ability to practice as a physician and to serve my country at the same time. So from there, I was trained in emergency medicine. So while I was on active duty full-time in the military, I got a nice award from the Surgeon General, Outstanding Physician of the Year, basically. And I was the first ER guy to get that. Normally, it's our surgeon consults, right? Surgeons, steal so many of the acclaim, and they just got a different kind of personality. But so I was the first ER guy to actually get that award. And then I got selected to provide care for the presidents and the vice presidents and secretaries of state. So I got really interesting background at doing that. And from there, I had a little bit of an entrepreneurial spirit. So after I finished doing that, I actually had a break in service where I left the military for a period of time for about 10 years. And I set up a concierge medical practice doing what we did for the presidents. I brought in White House physicians that I'd worked with along the way.
So which White House physicians did you work with?
I worked with, I don't know if you knew them, Colonel Bill Lane, Captain Robert Darling's Navy, Colonel Lou Hoffman. Do you know White House physicians?
I don't, but I didn't know that, that was part of your background, but I'm sure some of the people listening to this would know who some of those, people are. I'm just, not really familiar with them, but, it's very interesting to hear someone who has, treated them and talk about them.
Yeah, it was a very interesting thing. And, people, you could just do a show on, presidential medicine. But, to tell you the truth,
what is presidential medicine? I think people would probably want to know that. What is that? What's
I'd sum it up this way. It's providing the medical care for the President of the United States and also Vice President of the United States and former presidents. It's a very interesting practice. And so what's different about it is, first, you use the same standards of care that you would use within your particular field. So we had, the White House will have primary care physicians, will have internists, internal medicine, emergency medicine. So a variety of different physician expertise, and they'll tap in wherever it's needed. So if you need a neurologist or an internist, a neurosurgeon or something, we would know how through referral and our networks to go, and you could get that kind of expertise. But it's basically the need for our country to have medical capability within, we call it the bubble of the president or vice president, where if they had a heart attack or got shot or something, there was that capability in place to intervene and try to preserve, because you just having gone through an election, replacing the president is way worse than replacing a CEO of a company. And so organizations and the United States Senior Executive Service has long figured out the need to try to have capability in place. But even though we had amazing capability in place, if we had to be ready to do an emergency thoracotomy, crack open the chest of the president, cross-clamp his aorta, in seconds, be able to respond right there if that happened. One of the things that really did not happen was very often was prevention. There would be kind of family practice, we'd have that, typical stuff but what I see as a real need to do is change the diet diets and lifestyles of the president. And we just did, there's not a lot of that going on. It's very superficial. So
it seems like when these, people get into the White House, yes, they have like great access to physicians. They have really good access to physicians that, if something terrible happens or something acute happens, they have someone there for them. But it seems like what you're saying today, Dr. O'Mara, is that a lot of the focus still, even with these physicians, was not on primary practice. It was not on prevention. It was mostly just on acute care. And that's something that you want to change. Is that correct?
Yeah, no, that's exactly the case. So I'm big on, photographs, biometrics. Okay. Your face is a barometer of how healthy you are. And I will tell you first impressions, Mike, you're in good shape. I was looking at you to Ben. You will have less visceral fat than Ben does. It's interesting. I can read the spatial inflammation. So
how can you tell that right away?
Well, let's look at it. Let's get into it.
Okay.
So here is President Biden at 2020. This is President Trump in 2020. Okay. This is their facial photographs. Let's look at their faces 4 years later. Okay. The time interval is 4 years. So what do we see here? This face has become edematous, is whiter, and more inflamed looking. If I were to ask you, have they increased inflammation or decreased it as a physician or as an average human being, most people would say this is a more of an inflamed look rather than less inflamed. But look at the photograph from President Biden from President Trump from 2020 to 2024. He decreased his inflammation. So there are a couple, I have a lot of confounders. A couple things happened. One, this guy between here was president. This guy from here to here was a private citizen. So the stress level is considerably higher when you're the president of the United States. But there's another interesting factor involved in it. They had physicians in their lives. So let's look at the faces of those that were in charge of their medical care. So this is I forget his name. I think his first name might be Kevin. This is the Navy physician that took care of provided medical care to the president, advised him on medical matters. But this is the Navy physician that provided medical care to President Trump. So the level of health are very different in these two. So how healthy you are actually is shown in your face and your ability to influence. So if you are a social media influencer, you're a CEO of a company, you're a C-level of a large company, or you just have a prominent ability or need to lead people and influence them, you want to be as healthy as possible, because the healthier your face, the more people pay attention to you. And this is biology. And the reason is we have always been hunters. And so the one objective everybody had was to hunt to get meat until about, 20, 30,000 years ago, when we switched to an agricultural-based hunter and practice, and we became farmers, basically. And then we start diversifying in other lanes. But biologically, we are adapted, have evolved to, and have imprinting software in our brains that are always working to pursue health so we can hunt better. And we pay attention to the man or woman, and women are hunters too, throughout the existence of Homo sapiens. Women, we look at their faces of men and women, and those that look like they hunt well and can hunt well, we pay more attention to, because our primitive software imprinting says, listen to this person because they may be able to help me hunt better. And to the extent that you hunt better, you live better, you survive better, and you live better. So the quality of life, your capacity for thriving, is dependent upon your ability to hunt. So we assign value to the appearance of people. Now, here's something interesting. I just coined this probably a couple months ago. Instead of presidential medicine, I'm calling it political medicine. So political medicine says to politicians and leaders, particularly the political realm, you need to be healthy if you want to get that vote. And so if you take the facial photographs of the Republican and Democrat candidate from 1960, I did this up to 2024, you will, by and large, not by and large, in every single case, at least to my own eyes, the person that was the healthiest won. The person that was the healthiest appearing won. And so it's interesting when it came to women. I want to study Kamala Harris's face a little bit more, but Trump has this very kind of alpha look to his face. And if you ask the question, which of the two candidates their face, now set aside politics, okay? It doesn't matter, Republican, because the Democrat would win if he or she had a more alpha-like face. So I suspect what it came down to this election was there was more of an alpha, kind of a lower inflammatory look in these faces. But go back and you'll find it interesting. And so if you're listening today and you're a politician, you're going to want to have a healthy body and especially a healthy looking face so that you can influence people better. And if you're a teacher, you're a consultant, you're an attorney, you're a doctor, you are whatever you do, you're going to be an influencer. And to the extent that you optimize your health and get more healthy, you're going to be able to better influence more people and be more effective in whatever it is that you do.
So coming back to this, hunter-gatherer and what people are looking for, certain features, you talked about some facial features. So you talked about, going from having a little bit of a whiter face, and you can see that in the background or your pictures there now, the face becoming a little more edematous or, a little more puffy. What else is there within the face? And then there's got to be something too within the body, right? Because like for my understanding too is this Adonis physique, and maybe this is, again, the like sexual attraction is probably more of like the in some ways like intellectual attraction or just physical ability attraction, because that this person is capable of hunting and gathering, so to speak. So that for men, and then specifically for women, if you can get into what facial features they have maybe separate from men, because we know that men, it's more of like the chiseled jaw kind of thing, right? I think that's one of the more. And then for the body for a man, it's always been like small waist, but large like back and kind of trap, so like a V shape essentially. So a big difference between your hips and your chest. I think that the difference that people try to go for is at least like 10 inches, maybe 12 inches or more would be better. And again, some of that too is a little bit genetically predetermined, especially your waist. Your waist, you can certainly shrink quite a bit, but some people are genetically blessed with like a really small waist, and some people just aren't. But if you can talk about the specific features that we're looking for in the face with regards to men, and then specifically with women, and then if there's something regarding the physique or the body structure, that'd be interesting as well.
Yeah, so here's a couple other examples. We'll show a couple other photographs. This is an individual who had a heart attack, cardiac arrest twice in 1 week, CPR and defibrillated twice in 1 week. That's a bad week. Not too many humans go through that. And this is the photograph after his second defibrillation cardiac arrest, and he recovered. So he looks horrible in that particular case. Well, he starts doing the strategies, and I won't get into just yet. You can get them online, but he started doing my strategies, and look how much he changed his face. And this is 3 months. 3 month period of time, he became the dramatic improvement in his appearance. So leaner, more defined, healthier looking eyes, and just better perfusion of the skin. So you
How,
can
how
see
would you define healthier looking eyes? Like I'm seeing the pictures now, and I'm sure there's some people that are watching this, but some people are probably just listening online. Like when I see the eyes, I see on the left, the eyes definitely look a lot puffier than the eyes on the right. But if you can maybe just, tell us.
they're more puffy, but look at the eyelid is droopy. So one of the things that happen as you age, your capacity, I think they're called the Vittorelli or something, whatever those,
That's what I was going to say too. So if we're both thinking the same thing, we're probably right.
Yeah. So it's puffiness, which would be a reflection of edema, maybe, and inflammation, but also mitochondrial functionality. So the tone, the firing, the resting position of the muscles that are responsible for the eyelids have improved dramatically here. And we see this very often in just acute interventions like fasting. So fasting will create mitochondrial biogenesis. Okay, an extended fast will improve. So very often we see this kind of improvement in the eyes and resting tone, the resting tone, tonicity of the muscles and a relaxed state improve. Probably, I'm going to guess because of mitochondrial biogenesis, they just have a higher level of energy, ATP. And so just the appearance of the body and face are optimized. So
poor mitochondrial function then can lead to the features that you're just describing. Including
just improving your mitochondria. And you who have good mitochondria are kids, healthy, and who have bad mitochondria are diseased people, usually in a linear fashion that tracks age. So as you get older, you usually acquire more visceral fat and more disease. And so this is my own transformation of my face here, filled with visceral fat at the age of 48. And then how much my appearance changed at age 60. I think I'm 59 there, actually. Age 59. And so dramatic improvement in the appearance of my face. Even the texture of my hair. I had very straight hair all my life, sort of like a pointer dog, very straight hair and laid flat. Now my hair is very textured, a lot more thicker. It has a different appearance. It's not like I turned into an afro, but I got these like curls and swirls, and I don't know what to describe it, but it's more of a salt pepper look. And
this is again more. This is all due to increased or improved mitochondrial function. Is that correct?
Well, I would say if that comment is like saying somebody who becomes really educated. It's all due to the fact that they did really good in English. No, here's what it is. Mitochondrial function definitely improves, but so does blood flow. So does perfusion. So does offloading of nutrients in the vascular bed. So does the capacity for hemoglobin to be saturated with oxygen. In other words, mitochondrial functionality is but one factor of a multitude of things of which you and I, sadly, are not educated in our physician colleagues from the standpoint medical school about what you got to do to optimize human beings. So today, I have left the practice of emergency medicine, and now I'm specialized in a field called health optimization. And when I say to somebody, well, I'm a health optimizing physician, you know what they say? This is the problem. What is that? Oh my God. Every physician should be a physician who specializes in health optimization, or we need a lot more of it.
Yeah, I was going to interrupt you there just for 1 second there, Sean. There's one question I want to ask you, then I want to make a comment on that. Just regarding the eyes, because I think some people are interested in this, and I've chatted about this recently, and I don't know if you've used this in any of your clients, but have you used any topical caffeine around the eyes? I know it's more of a cosmetic thing, but the understanding is that when you have puffiness around the eyes, use the caffeine, which causes vasoconstriction, which reduces the puffiness in the eyes. And there are studies online which indicate that that is an effective technique for reducing puffiness. And then I do want to make another comment on what you just described about health optimization. But just regarding the topical caffeine, is that something that you've looked into or that you've used with any of your clients?
Yeah. So here's my take on that, Mike.
Okay.
That's an early shot paint job.
Okay.
Yeah. So what do I mean by that? Is, dude, you have got to get away from these little cover-ups. Forget makeup. Take your patients and improve them from the inside out.
But can't you also improve them from the inside and the outside? Like, wouldn't you think someone who, does all the things that you're doing regarding, whether it's improving your mitochondrial health or, any other thing that you literally have on your list, but then you also add in the topical caffeine, do you think that also, may just, improve their overall appearance a little bit?
Okay, I'll put it this way. Stick with the topicals, stick with medications, stick with all those things. You'll win way more money because that's what people want. They want shortcuts. But what we need are researchers that say, you know what? We don't have time to be wasting, and the return is so much better from the inside that we're not even going to look at that. So I don't look at any of that crap. It's a part of a lot of people's practices. I'm in all these longevity groups and all these for doctors to do those kind of things. Listen, when you come to me, I'm not telling you to put stuff on the outside of your body or medications or anything like that.
Can you stand yourself on the camera?
Change your life.
Yeah.
And that's what I get people to do. And I would much rather, them. I want them to be pissed off at their wrinkly face and not get relief by putting on a vasoconstricting methylxanthine like caffeine. Although it work, I want them to say, get up in their face in the morning and see those wrinkles and be troubled about it and say, this is why I'm going to fast today. This is why I'm not eating that damn muffin. And so to the extent that we run around and do early shot paint jobs on people where we just do kind of superficial things, we diminish our capacity to reach into their lives and help them make the necessary changes that they need to do to change from the inside out. So I'm not trying to be critical of you. I mean, that's a lot of physicians do, but it's just not part of my practice. I'm not looking to do, a short-term fix. I want people to look like hell so they get motivated in the morning and don't eat that damn glazed donut. But if they use, do an early shot paint job, they get a facelift. They say, wow, look, I'm tremendous.
John, just make sure you're in the center of the camera if you don't mind. It's hard to see your face when you're kind of offset there. Yeah, sorry, go ahead.
Okay.
Yeah.
So I was trying to avoid. So in this face, you want to look at women a little bit. This is my wife 2 years ago. She won't let me show her face 15 years ago when we got started because it was a lot more inflamed, a lot more edematous. She'll let us show this photograph, but look how much she improved in just the past 2 years. So this is an example of a female improving that particular much. And then let's look at this physician. Okay, this is a radiologist, Dr. Hannah Rosa. And she's very healthy, extremely intelligent. She did 2 residencies in radiology. She's like triple board certified fellowships, and she is a highly accomplished radiologist in academic appointments. But look what happens to her over a period of time as she accumulates visceral fat. And this is the first radiologist that I taught about this. This is what she ended up later going to. So now you see that inflammation, besetting her face. And really, it changes dramatically the appearance of people. And now, a year and a half later, as she's reducing that visceral fat, you could see that. So she was chief of radiology at a VA hospital where I was working. And I went in to talk to her, and she was the first radiologist. And since I've become an anti-inflammatory physician, I was able to get to listen to me and start reading visceral fat. And the way I got her to do it was, Mike, I said, in the VA, when you open up a MRI scan, rating record on a vet, you see all their diagnosis. EMRs allow you to do that. And so I said, here's what you'll find in every single one of them. The more visceral fat they've had, the more diagnoses they're going to have every single time. And you're not reading it, and no radiologist is. And we need to pay attention, because you need to start reading it. And the 22-year-old veteran, when they get out and get into the system, and say, you've got a concerning amount of visceral fat in you, and it's going to get worse, and we're going to report it. So she reads it, she reports it. But unfortunately, the FPs of the VA don't know what to do with it, right? So they're like, what am I supposed to do about this? And so she gives them my strategies and content to start doing it. But we need to educate people about that, because visceral fat has such a negative influence on your appearance and the quality of your life and your health. You need to think of visceral fat as a disease process inside your body. So it's a highly inflammatory fat. So if it's disease, you want none. So first thing is, you got doctors that ask, well, how much visceral fat do you want? You want none. It's like cancer. It's like arthritis. It's like degenerative joint disease. You don't want any of it. It's not like this stuff does any good. It does absolutely not. Everything it does is destructive and harmful to the body. So nothing will improve a human body more, a human being more, than eliminating this highly inflammatory fat within the body. Nothing. If you can, as a physician, a researcher, politician, whatever you are, and you're listening today, if you can tell me something better that improves human beings, let me know, because I'm a health optimized physician, and this is what we have found for the National Science Foundation has the greatest impact. And how does it have this impact? Well, it's because it's inflammatory and it releases inflammatory molecules. So, just to show, what if there's anybody of a scientific nature wants to know what are interleukin-6, tumor necrosis factor alpha, resistant. So adipokines, it's basically inflammatory molecules.
Would CRP go up as well? C-reactive protein?
It is, but CRP, you can get it to go down by just changing the diet and maybe do some fasting stuff, and you're still with visceral fat. So rather than follow CRP, it's way downstream, and it's so dynamic. Follow the head of the snake. You got to kill it, which is visceral fat.
What would be the best blood biomarker to measure visceral fat, would you say? Or there's really not really good ones?
Nothing comes to mind. Okay. I took care of royal family members, billionaires, managing directors, hedge funds. I've ordered, in some cases, millions of dollars of blood work in an individual. I mean, you're not going to like this, but I'm going to tell you, do you remember the last time I ordered blood work on myself? 5 years ago.
How come?
I just track visceral fat. Okay. These blood markers are so dynamic. Mike, they change daily. And with the exception of maybe A1C or something, but it's way downstream.
How often do you check your visceral fat?
Oh, well, I have the ability to get myself scanned. So I will scan myself maybe once every 3 months or so. I'll track my visceral fat.
And I know you have a video, Dr. Mara, where you talked about DEXAs versus MRIs for visceral fat. So for people who want to measure their visceral fat, can you explain how they can measure it, and then the difference between the DEXA and the MRI? And from my understanding, you much prefer the MRI. So for people who, again, want to have some kind of quantification, some kind of objective measurement of the visceral fat, what are your recommendations?
Yeah, so I definitely recommend an MRI over a DEXA scan, because you get to visualize your visceral fat. DEXA scan just gives you a number. And Mike, have you ever shown a lab study to a human being and had to pass out on you because they got so upset?
I haven't had them pass out on me, no. But obviously, I've had.
What happens to me? I've had people get so upset. I've had to think about calling the police. They're so mad. They start screaming and cussing in my room, and other clients in the waiting rooms, the patients here. They get super upset. They start crying very often. They pass out. So what am I telling you? When you see disease in your body, you're way more upset than you are if we show you numbers. So that's why I don't even work with labs. I don't do any blood studies. I just track visceral fat, and a DEXA scan gives you a number just like a lab study. It doesn't show you the visceral fat. It gives you a number. And so nobody changes their life nearly as much from a number. But when you show them an MRI and actually, allow them to visualize that visceral fat inside of them.
And Dr. Merritt, when you're talking about an MRI, like, are you talking about like a full body MRI? Like, what kind of MRI you're talking about when we're measuring visceral fat?
Yeah, so I'll show you. Maybe I'll pull up an MRI so that we can actually discuss it and get a better view of it. So sometimes you can use. I do occasionally. I'll use a full body MRI, but for the most part, all that you really need to do is to get a MRI through the abdomen. So I'll show you what that entails, what it looks like by looking at directly.
And so I think that's a really important point, though. So what you're saying is that, for people who want to measure their visceral fat, the best way to do it, or the easiest way to do it for them, would be to get an MRI of their abdomen, because obviously, full body MRIs are going to be significantly more expensive, likely, significantly more to access as well. So the MRI of the abdomen is sufficient overall. Is that correct?
Yeah. So here's two MRIs. This is the anterior abdomen. You lay in your back. These are your back muscles. So muscles are dark, fat is white. So you can see the muscles in this individual. By the way, they happen to be brothers. So it's kind of interesting. They both have elevated amounts. Visceral fat is all that white stuff inside. And so they're bulging up, their bellies are bulging up, laid down in an MRI scanner because the amount of fat that's present in them. Now, let me show you the faces of these individuals with elevated visceral fat. So you can see their faces aligned with their scans. At the same time, we took the scans, we took their faces. You ready for this? Hold on. They're kids. Mike, this is going on, and your kids that are coming to you, they're filled with visceral fat, and look at their faces. They look like average kids coming into your practice, walking by you in the mall. But look what happens to their face when they get rid of visceral fat. I showed this to a pediatric endocrinologist. She broke down, started crying. Because you and I, if we're honest, we never see this. We don't see kids improving this much. So let's get into it. Look at their lips. Small, narrow, and poorly saturated with oxygen. Now look at those massively perfusing lips with saturation of hemoglobin with oxygen, dramatically different, with improved circulation of blood in their faces. Their eyes look so much better. And this is what I'm talking about, health optimization. And this is the kind of medicine that you and I should have been taught in medical school. We're not. We're taught to treat disease, and we make money off of it. But what we need to be is paid for when we improve kids this much. And there's no model for it in our healthcare system today. And it's because there's way more money in disease. But this is what you should be paid when you go see Dr. Mike Hart. You should be paid for the results that Dr. Hart gives you and how much you improve. And that's what I go and talk about. This is what I've tried to get, a model in our healthcare system that rewards a physician for the results that they get and how much they improve, and teaches that physician the metrics and the consumer that health optimization is a real thing. It's not the elimination of pain from arthritis. It's the elimination of arthritis in the body.
I want to get into health optimization and maybe some different ways of practice. But before we kind of close off on the visceral fat, I don't think we've really discussed we've discussed obviously the like the facial and cosmetic implications of having high visceral fat. But what are the medical implications of having visceral fat? Why should people be so worried about this? What effects does it have on heart disease? What effects does it have on pathology overall in the body?
All right, so I could the best answer that I could give you is, if you're listening, I could tell you all those things. It's not going to matter because you won't believe it. Here's what you need to do if you're listening, and I'm talking to you too, Mike. Whatever medical problem you have, just jump in Google and type it. If it's arthritis, if it's Barrett's esophagus, if it's gastroesophageal reflux disease, if it's diabetes, whatever ails you, whatever the heck is your problem, put it in Google with a comma after it, and then type 2 other words, visceral fat, and see what science shows. You're not going to listen to me because you're like, I heard this guy talk. That can't be true. I've never heard this before. Look at the abundance, thousands and thousands of studies on visceral fat. It's kept from you in medical school and it's kept from the consumer, and it's all in PubMed. So read the studies and see that every condition, I've yet to find a human being have a condition that hasn't already been linked and connected to, associated, or from visceral fat. So if you're listening today and you got a condition and it's not from visceral fat, I'd like to hear from you. If it's chronic disease. Now, if you get something like Down syndrome, that's a genetic disorder. That's not a chronic disease. And so the implication of visceral fat to that probably exists. I mean, probably the previous ancestors increases the likelihood of trisomy 21, but it's more chronic disease. So the study we did for the National Science Foundation that lasted 7 years, covered over 6,000 Americans. We scanned them for visceral fat, and we recorded what their self-admitted conditions were, what kind of chronic disease they had. And in every one of those 6,000 Americans, their chronic disease either improved dramatically or went completely away during the time period that they were studied when we eliminated their visceral fat. So I, again, know nothing better for improving the quality of life, the quality of health, and eliminating disease from a Homo sapien than eliminating this dangerous visceral fat. And also, besides this visceral fat is found within the muscle.
Okay, can we talk about targets though, just for a second? So, people want to have, some kind of objective numbers or targets to look at. So when you see someone and their visceral fat is exceedingly high, like what is there a percentage that shows up like within the MRI, or is it just that you're looking at the MRI itself and you're seeing, the shrinkage of it? Like, is there any, kind of quantifiable objective measurement there? Is it just like through looking at it with the
That's the most important thing.
Okay.
When we start reducing the numbers, what we found is very interesting. If we just had them look at their MRIs and how much they improved, they had way better results. But the minute we quantified it and we had them look at it, they got less interested. Numbers seem to make people less motivated. What really motivates them is only seeing the disease. So how did we find this out? We developed at considerable expense our own proprietary ability to measure visceral fat. We spent hundreds of thousands of dollars developing the software. You know why we did that? We threw it away because it started reducing the ability of a human being to actually improve and get results. So all you got to do is show improvement in people. What you really need to do is this.
So
this is
literally,
an NHL
Sean,
hockey player.
Just to back up, just for one second. So literally with your clients then, like for before and afters, you're just looking at, hey, this is what your abdomen looked like before. You can see all the fat here. This is what your abdomen looks like now. There's significantly less fat. And that's how you quantify it. Is that correct?
Yeah. I don't even want you to use that term, quantify.
Okay.
That's how you assess it, how you evaluate it, how you see whether it's important. So this guy's an NHL player. started a business. He's a billionaire now, very, very wealthy. His is here when he came to me about 10 months ago. And 3 months later, look at the reduction in that white, okay? So what really matters is this guy isn't concerned about your MRI. He's not concerned with what happened at 300,000 other people in Wiesbaden, Germany, or MRIs. He's concerned about one, the N of one, what's happening in him. And that's what we do. We work one-on-one with our client patients to say, we're going to pay attention to you and not what happens in all these other people. But this guy improved that. And that's the kind of assurance you want to have that you're getting better. When you come and do these strategies, work with me, your report card and our report card, and if we did our work correctly, and I assure you we did for the National Science Foundation, is based on results that you get when you repeat your MRI. And so it's not only that visceral fat, but his muscle fat. You see his fat that he had in his muscles here, the erector spinae muscles that keep your back straight. Look at how much he reduced it in 3 months. And the size of his muscles increased. He burned fat, got rid of dangerous fat, and he built muscle in 3 months when he took a focused approach where we studied it for 7 years, how to build muscle, how to build healthy tissue. And we weren't like trying to turn people bodybuilders. We just wanted to create, as we got rid of disease tissue, we wanted to replace it with healthy tissue. And really, it just happened natural. It wasn't like we ever tried to put on muscle in our clients. We were just trying to get rid of the disease. But what we noticed happened was they, in fact, did that. They put on healthy tissue. So the natural healthy body's pursuit of just living is to put on tissue and not put on disease. So when you
how do people then
muscle grows.
So how do people reduce their visceral fat? Like, how did you get this client in 3 months to reduce his visceral fat so much?
Yeah, so we give them 48 things to work on. And an interesting part of our National Science Foundation is we gave those 48 things away to the U.S. military and to firefighters and law enforcement and state troopers. And you know what happened? Almost nothing. Because when you give away stuff for free and you don't do an MRI, hardly anybody will do it. But when you do an MRI and you show them the disease and you have them give you a chicken or a bag of apples or money, they buy into it. Now they appreciate and they get much better results. So online, I give away, about 6 or 7 things for people to do. And I'm at the point that I think I should just take it away, because a lot of people say, well, why do anything else? I don't need to optimize. I don't need to go this practice. And they just settle for just doing a few things. But what you really need to do is be immersed in a group of other human beings that are pursuing health, and you learn many other things to optimize. But the long and short is you want to cut out processed foods. You want to fast. You want to go outside and get sunshine so you can increase your nitric oxide. And you want to eat fermented foods, so that you get microbes added into your diet, which almost no, human beings currently are doing today, except for some traditional people that traditionally eat their meals concomitantly with these microbe-rich fermented foods. So those are the basic things. But if you're listening today, you want to, it's linear. The more you do and the better you do it, the greater your impact in improving your health and eliminate your risk and your threat of disease. But the biggest threat you face, most people, is not they're going to get killed in a car wreck, or get shot, but they're going to have a heart attack or get cancer. And so if you're an individual that, says, man, I've got a great life and I don't want to lose it, then you better get your butt to a health optimizing practice that focuses in on what gives you the fastest and best results to eliminate your threat. When we saw a threat to the president, we would act very, very quickly. But today you got men and women living in a home with a guy walking around with a Glock in their backyard, and they're, casually pointing it towards the windows in their backyard. And what that is visceral fat and fat around the heart. and they just don't know it. They don't know that they have that persistent threat within them. But you want to do as much as possible to get rid of those, and that's why we specialize in this particular fat, and why I'm trying to teach other doctors about it.
Yeah, I like your approach, and I had actually my very last guest that I had on that podcast actually comes out today, Dr. Abud Bakri. He's in the States as well. He's a great follow on Twitter, by the way. He was
Send me his contacts. I don't know.
Yeah, sure. He was kind of talking about the same thing, that like, in primary care, we sort of need to get to a point where like you have one person who's there for, what you would call health optimization, or what, someone may call it something else, medical optimization, whatever it is. And then you have another primary care when you go and, you have a sore throat, or you have an infection, or you have something that like, acutely needs to be taken care of like that day or the next day kind of thing. And I see that, because the reality is that it's very difficult to do both. Like when someone comes into like a walk-in clinic in the setting that like I work in, and there's, 20, 30 people in the waiting room, and you're just trying to basically, treat people, as efficiently as you can, the best as you can, you can't get into all this stuff and talk about visceral fat and all the things that we've chatted about here today. So I really think that your approach is something that has, been on maybe the minds of, other physicians as well, but, it certainly hasn't been come to like the forefront. It's certainly not mainstream. We're probably just on like the very, brink of this, of like this, early kind of primary prevention practice. But I do agree with you. I think that it's, and I've chatted about with other physicians this before, like it's almost impossible just to take care of like, one person for everything, and so you kind of have to separate, I think, their, primary care practice into maybe, someone who takes care of your acute conditions, and then someone who takes care of your chronic conditions. And then I think, you obviously have, tremendous experience with both, being an emergency room physician, and then now, doing this health optimization thing. So, you're really, the perfect person to kind of have an opinion on this. And that seems to be what you think is, and it seems to be what you're doing and what you're practicing, is that, you have, your urgent care or medicine or, emergency physicians to take care of your acute infections. You get something in your eye, you need someone to take out of it. You get a really bad throat infection, you have strep throat, you need an antibiotic. That's a lot different than, coming in and talking about your visceral fat. So I do, appreciate what you're doing. And I think that, we need more physicians like you offering this kind of service to people.
Yeah. Well, if you're a physician, I'll offer it to you. And if you're a physician that is listening to Dr. Mike right now, you can contact me, and I'll put you in a WhatsApp group with other physicians who I'm teaching and allowing them to share about visceral fat. I got doctors now all over the country, and our latest addition is an ER physician in India who's just scanning people in the ER, and who's reading CT scans full of visceral fat, and he's telling these people why they got diverticulitis, why they have a heart attack, showing it to them, and then even doing MRIs afterwards, on them, instead of having to do follow-ups with the radiation associated with CTs. But
on that note, though, if people can't access an MRI, is a CT reasonable compared to an MRI, or what are your thoughts on that?
Yeah, so you can absolutely see visceral fat on a CT. So in your patients, look in their medical records, their EMRs for their CTs. And in a CT, the only difference is the colors are inverted. So visceral fat is actually, there it is black. So see all that black in there is visceral fat on a CT. The muscles now are white, and the fat is black. So this is, visceral fat, and that line going in here separating this subcutaneous fat. You can either see scarpa's membrane in there from deep subcutaneous fat and superficial subcutaneous fat. So read about superficial subcutaneous fat. It secretes adiponectin. And for God's sakes, read about adiponectin, adiponectin, is protected against heart attacks, strokes, neurodegenerative conditions, MS, Parkinson's, Alzheimer's, dementia, diabetes, and even obesity. So it's a type of fat that protects you from disease and from fat. And this is just the opposite. Deep subcutaneous fat is just like visceral fat and fat around the heart and fat in the muscles. So deep is bad, kills you, causes disease. And superficial subcutaneous fat is super beneficial. It's almost like a bulletproof vest that you don. So, you know, I'm proud of the fact I don't have a six-pack except when you do an MRI on me, because I keep superficial subcutaneous fat on my abdomen. And I actually will tell bodybuilders when they come in and they have no superficial subcutaneous fat, you see nothing but striated muscles, that they're actually in a suboptimal disease state, because you need that superficial subcutaneous fat to protect you from threats and harm and disease and improve your appearance. So
yeah, I that's really interesting, Sean. I don't want to get too much off on a tangent here, but I'm a big UFC fan, and there's probably a lot of people watching this who are UFC fans as well. And like one thing that people do find, and something that's kind of like strange with fighters, like people who are not fans will look at one guy and be like, oh, this guy's way bigger than the other, is way more ripped, he's gonna win. And that often is not the case. And obviously skill comes involved there and all different kinds of things.
Great point, Mike.
But one thing though too is that like it seems like those guys burn out faster. Like there's something about having like a certain amount of fat that allows you to, seems like it just gives you a little bit more of like a work capacity to some degree. Is that something that you could explain to us?
Yeah. So my guess, to the best of my knowledge, it has been studied, but I would surmise that superficial subcutaneous fat is more accessible. So when you need it, it's like this fuel tank that you can tap into and extract it. And you can see that scarpous membrane here. So if you got that superficial subcutaneous fat, I'm going to guess if we did a study and looked at individually the fat depot of superficial subcutaneous fat and the fat depot of deep subcutaneous fat attracted to performance, you will find humans will be stronger and faster and better performing overall with optimal amount of superficial subcutaneous fat, and they will not be as good performing with deeper subcutaneous fat and more visceral fat. So I think it's probably just more accessible. So when you need it, to fight immediately or to sprint, you can access the superficial subcutaneous fat way better as a source of fuel and energy than this particular fat here. Now, it will go. I mean, you can use it as a source of energy. It's just not as exploitable. That's how I'd explain.
Interesting. Okay, thanks so much for explaining that. And now I'm going to go off on a completely different tangent. So we had some very interesting results from the election the other night. I've been pretty vocal in saying that I'm, very happy with the results. I'm very interested to see what, Robert Kennedy Jr. is going to do. You're an MD, you're a JD, what are your thoughts on this election results, and what do you think Robert Kennedy Jr. can do, and how do you think that may even impact your practice overall?
Yeah. So I think RFK is amazing. I think he's an influencer. He is clearly interested in the health space. Maha, make America healthy again. This photograph of these kids changing this much was sent to President Trump.
Amazing.
So, yeah, because of the reason it went to President Trump was because of this guy here came to see me. It turns out he's Trump's attorney. And this guy came to our practice and he withheld that information. But look at we didn't even discuss it. When he came in July this year, you had this big chunk of fat around his heart. Okay, that's epicardial fat, pericardial fat surrounding the heart. And then look how much he dramatically removed it in just 3.5 months. I mean, a tremendous elimination, but he also removed that his visceral fat significantly in that time period. So Trump's attorney was very motivated. He's a trial attorney. So, he's a very influential guy, RFK. And that's why I think Trump is like starting to talk about, taking on big pharma, taking on the FDA, RFK and those guys. I'm not saying it's because of me. I mean, I'm doing whatever I can to get this kind of information into influencers. But here's what I think will happen. I think you're going to see the first president in the United States in the history of our country that is going to go into the House space and try to help every single American become more healthy and articulate that. And he himself, he proved his face so much in the past 4 years. Nobody talks about it, but, Trump's face has changed so much. And RFK looks good. I mean, he's a better influencer because, his level of health. So I agree. With you. I'm optimistic.
When people saw him, doing those chin-ups, he posted that video, I think, a couple days before the election, maybe it was a week before. And I've seen him in lots of workout videos before, but there was one in particular that he posted, I think last week, where he was doing a bunch of chin-ups and stuff. And I think that people want to see that, they kind of want to take advice from someone who's actually healthy. They're sick of having, public health officials or, even maybe, healthcare professionals that look unhealthy that are giving them advice. And I think that, we talked about it for, half this podcast, by looking healthier, people are going to likely listen to you more. And I think that when it comes to health, that's going to be even further, because that's, literally the very topic that you're discussing. And so in terms of though, I'm not sure if you have thought about this too much, but in terms of your overall background, again, being an MD and a JD, do you see yourself getting involved with, public health and maybe with RFK, or is this something that you don't really want to do? You just want to stick to medical practice?
Well, I want to be able to continue to research and stick in my medical practice, but I would answer the call to serve, in any capacity to help RFK or President-elect Trump to help our country become more healthy. It's that important. Do you know, Mike, that the biggest problem facing our species, humanity, is chronic disease? But as physicians, we don't even talk about it. But the reason why it's the biggest problem is because we don't spend more money on any other problem. I mean, the biggest amount of money we spend for problems is on chronic disease. It's the largest part of our economy. And nothing deteriorates the quality of lives of humans more than chronic disease. And nothing kills more people than chronic disease. I mean, nothing even comes close to the problem that chronic disease is. And yet most physicians, gun to their head to guess what is humanity's biggest problem, won't even say it, because we're not educated about it. But that's what I want to do. I want to educate our country. I want to solve before I'm pushing up daisies. I want to make the largest contribution to eliminating the biggest problem that's facing humanity. It's not climate change. Climate change is maybe at the most killed 1 million people or 100,000 people or something. But this thing kills billions prematurely.
I agree.
We've got to solve this.
And so, given your background, and again, I really respect your military background and your law enforcement background. I have a lot of friends who work in law enforcement. The guy who trains me in MMA, his name is Chad Laprice, who's a UFC fighter. He's a cop here, and we train at least once a week. Sometimes we get it even 2 to 3 times a week. And so, and also too, like I said, I've treated, a lot of veterans, again, appropriately with cannabis. I'm very much against using, high, THC cannabis continuously. I think it, leads to worse outcomes, not better outcomes. But, you've got all this, background. So if you were in RFK's seat, what would you do to make America healthy again?
First thing I'd do is I'd go after processed foods. I would educate people about the problem with processed foods. And probably one of the most effective examples are this is a human being that eliminated processed foods, processed carbohydrates. That's all they did in this study, Mike. It's the only time it's ever been done in the history of humanity. This study right behind me. But here's what it showed. Visceral fat is that red stuff. The red stuff in the muscles is muscle fat. But look what happened in 2 weeks from cutting out processed foods from the inside of that human being. And by the time 35 weeks, he went from a dad bod to now looking like a collegiate athlete in his 20s, only 68 years old. And Mike, he didn't exercise 1 minute. This is what happens when you eliminate processed foods.
That's insane.
It's insane. And I don't want to get into this particular topic, but let me tell you, when I start going out on this thing, was I ever attacked? I'm going to tell you, America, if you're watching, this is kryptonite to processed foods industry and big pharma. I can't get into it right now, what happened to me when I start promoting this, but I just put this promotion, but this drives the evil pharmaceutical industry and processed foods absolutely crazy, because nothing improves the human being more to get rid of this visceral fat. And the fastest way to start doing that is absolutely cutting out all processed foods and just eating clean and eating whole form. And if I was an RFK.
When was this study done?
It was done during the National Science Foundation.
No. When? Like, was it done like last year, 2020?
Oh, no. It was about 8 years ago when we were doing the National Science Foundation study.
So 8 years ago, it's the only study of its kind, is what you're saying. So why hasn't this been replicated? If we saw such dramatic results 8 years ago, why hasn't this study been replicated?
All right. Give me the money to do 6 MRIs. You see the problem?
I understand. Yeah.
Now, I do have a client now who's wealthy enough. He's getting scanned every 2 to 4 weeks. So I am replicating, but it's not going to be as good as this, because my client, that's getting scanned every 2 to 4 weeks, he's doing 48 things. So this needs to be replicated exactly in large, but nobody will give me the money. I mean, it needs to be funded. RFK and Donald Trump will find that money, and we're going to do this, and 100 people or 1,000 people replicate it, just have them cut out processed foods and show it that it happens every single time. We're not going to have to do anything else but cut out processed foods. And then that needs to be shown and duplicated, but it's a lack of money. And when my clients come to me, Mike, they're trying to save their lives. And so I got them doing a lot more other things like sprinting and fasting and doing a sauna and fermented foods and things like that. So, but this is the compelling case right here. Just do one thing. You don't even have to exercise. Just cut out that processed foods that you think has so little contribution to your health that you're cheating on cheat days or whatever, and you just continue to eat this stuff. It's insane what it does to the human body.
It is insane, like regarding those images. And I do think that it would be fantastic for us to, replicate that study. I know we've kind of gone over our time a little more. Do you need to go there, Dr. O'Mara? Or?
Yeah, I should be wrapping it up the last few minutes, but we've got another 3 minutes. So we'll cover anything you'd like to cover then. Well,
I think in the last 3 minutes, I think what we should do is maybe talk about a little bit where people can find you, your Twitter handle, your Instagram handle, all that kind of stuff, because I'm sure that people would, really want to know a little bit more about you and the resources that you can offer.
Yeah. So you can find me on Instagram, Twitter, X, YouTube, TikTok, LinkedIn, all under the same handle, which is DrSeanomara. So I use that on all my social media, Dr. Sean O'Mara. And you can also go to my website, which is just same thing, DrSeanomara.com. And I have another website called growingbetter, not older, anti-inflammatory.com to
Your
help people,
book.
yeah, it's the name of my book, and you can buy my ebook, which is pretty cheap. I don't even know what it is, how much it costs, but you can find out about that. And then our medical practice, we're not in the business. We don't want to get people fish. Okay. We want to teach them how to fish. And so they go out. So we sell MRIs, a service where we help you get an MRI or you can get your own. But we're not interested in reading it for visceral fat. Everybody wants us to read it. We want to get you better. We want to get those results. Our passion is eliminate disease for humans. So we're not interested. If you just want a reading, don't contact us. But if you want to get better, then you contact us, and we have this Ultimate Start program that you get. It costs $1,800 if you have an existing CT or an existing MRI. If you don't have one, it costs $2,900, and we'll pay for you to get one. We'll go find one, and we pay for it on our own. So for right around $3,000, you get an MRI, then you work with us for 3 months, and we get rid of that visceral fat with you, and we do it all online. And we're going to optimize people. We want to disrupt healthcare through an online model in all the states, and that's what we do. So you can learn about doing that through growingbetternotolder.com or drshawnamara.com. And if you watch this, you find an industry, you want to get your MRI and get rid of disease and really optimize, we'd be happy to work with you. And if you're a physician and you're interested in learning more about visceral fat or maybe incorporating your practice, you can contact me, because that's what we need to do. We need to get other doctors to learn how to do this.
Amazing. I've learned, so much today. I'm sure that people who have listened, learned so much too. And, thank you so much for all the work that you're doing. It's amazing. And again, as someone who's, seen veterans before, I have to say thank you for your service as well. So, thank you for doing that, and thanks for all that you're doing. And also thank you so much, everyone, for listening. I really do appreciate it. And as always, I'll be back again with another episode soon.